What is going on with Labour's plans for part of our health service? They've pledged to end the 8 a.m. scramble for GP appointments. I have to say, you haven't lived unless, and many of you will identify this, you live in a house. 8 a.m., by the way, is also the time of the school run. So trying to get two kids ready for school, I'm not talking about two ordinary kids, I'm talking about my kids, so two nut jobs ready for school. That's teeth cleaning, that's all that goes with it. No screens, allegedly, arguments over breakfast, trying to get a 10-year-old even out of bed. When did 10-year-olds become 15, for God's sake? All of that. And then try to ring the doctors at the same time. You are caller number 73. Oh, thanks. And that's if you get that far. Goodness me. Anyway, Labour reckon they're going to finish all of this stuff by training more doctors and updating the NHS app so that slots are easy to book and rearrange. Under the party's plans, family doctors, physiotherapists, mental health specialists, dentists, district nurses, care workers and health visitors would be brought under one roof as part of a trial of neighbourhood health centres. Shadow Health Secretary Wes Streeting said his party was also committed to bringing back the family doctor to give patients continuity. Well, it all sounds amazing stuff, put like that. But is it likely to happen? And if it is, how quick would that happen? That sounds like a 10-year plan to me. Let's speak to former NHS Trust Chairman Martin Gower, who regularly helps us out with these kind of stories. Afternoon to you, Martin. I mean, it sounds like an incredible offering there. Can it be done?
Good afternoon, Ian. My first reaction to this was good luck. Let's not forget GP practices are independent businesses. The GPs are not on the payroll of the NHS, and many of them now are part-time, the doctors there. Out of my 12 GPs in my practice, 9 are part-time. So whether you want one of the part-timers as your family doctor or one of the full-timers who might be more available, if they're not on holiday, of course, then good luck. I just think this is something that has been, we're hearing an awful lot of this at the moment, Ian, where this is what we're going to do. There's not even any idea about how this can be achieved.
Yeah.
Nothing would be achieved, for example, with GPs without the support of the BMA. And so that'll be about, well, this is fine, we'll do all this, but how much extra are you going to pay us to do this?
Well, there's also, yes, so there's implications all round on this one, isn't there? And then where are you going to get all the extra GPs?
Well, they're not sort of waiting on trees to be plucked off.
Yeah.
That we don't import that many GPs from abroad either. They tend to be more specialist doctors who work in hospitals that come to work in Britain from other countries. So the quick way, of course, is to get more GPs, I suppose, is to have more locums, but that often reduces the capacity in other places in the NHS. So, and it would be remarkably expensive to import GPs. In fact, there have been many more GPs recently that have gone private. That there is a better way to reduce the demand for people to see GPs. And that, of course, is to do what almost every other country, certainly in Western Europe, does, and that is to charge for seeing a GP. Because I've found when I engage with GPs, two stories come out. One is that at least a third, and in many GPs up to a half of the people in that waiting room don't need to see a GP. And the other bit, of course, is that they're terribly, terribly stressed and terribly overworked, and they can't cope with the volume of patients they have. To me, one of the simple routes towards reducing this demand and reducing the silliness of the hundreds of phone calls at 8 o'clock in the morning is, of course, to make a charge. You know, in Ireland, it's anywhere between 45 and 65 euros to see a GP.
So, same as Australia have that system, possibly the French do as well. I mean, it's not that controversial in many other places. And of course, you would have exemptions for those that are not able to finance that, as we do with opticians and dentistry and the like. But broadly speaking, I would imagine, you know, if the truth be known, if you could be a fly on the wall in the reception of the GP surgery. I know it's a controversial area that you've got to get through the receptionist to get to the doctor, but I can only imagine the kind of calls they get, of which so many are non-urgent. A lot of it are either professional patients who just like to make that call and, you know, fancy a visit. Overreacting parents as well on issues around their kids, which is, you know, sometimes understandable because you don't want them to miss anything, but probably a whole range of things that might well change if you added a fee.
Yeah, I think it would. I mean, the other thing, of course, that happens if you, I've recently come back from a holiday in France, but what you'll see first thing in the morning in a pharmacy is a queue of people waiting to see the pharmacist for the very reason, and a pharmacist can prescribe. So, you know, if you've got a sore throat or you've had a stomach upset, you can generally be dealt with by the pharmacy. And the pharmacies are bright enough to say, look, you really do need to see a doctor. So you know, make an appointment for the next couple of weeks.
I thought they were doing that, Martin. I thought that was already meant to be, you know, in the current plans to get pharmacists and other areas similar to that dealing with those kind of issues.
It is in the plan and it is beginning to happen. But of course, there's the issue also of educating the patients. The people say, I don't see a pharmacist, I want to see the doctor. The doctor. I always remember when I first lived in America having a bad back, and in my recently arrived in the United States naivety, I rang up my health provider and said, I'd like to see the doctor, please. And the lady at the other end said, well, actually, what seems to be the problem, Mr. Gower? And I said, well, I've got a very bad back, lower back pain. And she said, you know, I don't think doctors are all that great at back pain. I think you should see one of our physical therapists first.
Yeah.
They can be very, very helpful. And she said, what are you doing at 10 o'clock tomorrow morning? So I said, well, I think I'm going to be coming to see one of your physical therapists, aren't I? And sure enough, and I never needed to see a doctor.
Yeah.
You know,
that's exactly it. Similarly, somebody I know who had constant headaches over here, who was American, kept going to the GP here. Well, the GP is not a neurologist and wasn't really in a position. And she said, if I was in the States and I went to the doctor, they would say, no, you need to go in that room there because that's where they're going to scan your head. And they'll do that as a first port of call. Whereas over here, it was after about 12 visits before somebody eventually offered to look at where the real problem was.
And in many places, if you take your children to see a doctor, in many, many countries, you see a community paediatrician.
Yeah.
So you jump the GP sort of initially. I think, Ian, also there is an interesting point here. I mean, this thing that the Labour Party said that millions of people are waiting a month for an appointment, that's not altogether true. I mean, 52% of people see the doctor on the same day or within the next 24 hours.
Wow.
Now,
why aren't the Tory party shouting about that? They seem pretty inept at even, you know, talking about their own successes.
Well, they are pretty inept at most things at the moment, in my view, Ian. I mean, the campaign they've run, I mean, we have a plan, he doesn't have a plan, and that's back to square one. What does that all mean? Nothing. You know, what is square one? It's a nice sort of saying, but it doesn't mean anything.
No, there's no meaning to it whatsoever.
And the other thing is the family doctor point. You know, rather like Downton Abbey. Let's call the family doctor in. You know, she's not looking too well today, and he's in the next 10 minutes. Andrew Lansley, who was the first under the coalition government in 2010, he was going to reintroduce the family doctor. Didn't happen. Several of the previous Labour secretaries of state were going to reintroduce the family doctor. It didn't happen. And of course, this won't happen either. Jeremy Hunt, who's our longest standing ever Secretary of State, he was definitely going to bring us back to the family doctor.
Oh, yes.
It didn't happen. And this won't happen.
Why can't the family doctor thing happen? Is it just we have too many people? Was it always a bit impractical, if the truth be known? What's the reason?
If you look at the history of it, Ian, there was a time when 90% of GPs were male. And I'm not trying to be sexist here, but a large proportion now are female. And if you take the practice that I belong to, which is an excellent practice, and you do get same-day appointments, very well run indeed. However, let me just say that 9 out of my 12 GPs are part-time. And many of them will be women, and they will do things like take the kids to school, and they want to do 5 days a week, maybe about 25 hours a week, that sort of thing.
So it's that juggling of childcare is clearly a a factor in this?
Well, the Tories have said all along that they've increased the number of GPs. That's true. What they haven't done actually is to increase the GP capacity because of this shift towards part-time working. And I think that applies in many other areas of the public sector as well.
Yeah, fair point. Listen, we could talk for longer, Martin. It's always great to gauge your views on these things. He is Martin Gower. He's a former NHS Trust chairman, knows his way around the health service.